see. All right.
It says
So
meeting recording is in progress.
Yes, so I'm going to move. I don't know how to move that box. All right, so I think it's still recording, and we will get started. And good morning, everyone. I am Shannon Jones with the Tennessee Commission on Aging and Disability, and I am the Aging Program Director for one of our programs here, which is the State Health Insurance Assistance Program, also known as Tennessee SHIP. And there are SHIPs in every state. It is a federal grant from the Administration for Community Living, and we are really excited to be able to share with you a little bit about Medicare. We've got a short session today, and you can ask any questions. We've got such a small group. I think if you would like to ask a question, that'd be fine. Most of the time, your question will be answered on the next slide. So if you just want to wait, just a pause with your question, I might get to it on the next slide. Otherwise, feel free to ask me. You can also send it in a chat, and I'll be more than happy to address it that way as well. So we'll just go ahead and get right into it. We want to make sure we're all clear on what Medicare is. Many times we talk with folks and they aren't sure whether they have Medicare or Medicaid, and the easiest way I found to keep up with the difference is that Medicare is health care for those folks that are 65 and older or under 65 with certain disabilities that they have been deemed disabled through Social Security, or at any age they have end-stage renal disease. Medicaid is actually aid to the poor. So there are some limited financial resources for those folks with Medicaid. So we're going to focus on Medicare today, and that is administered through the Centers for Medicare and Medicaid Services. And you will get a card issued by Social Security Administration. So Social Security and Medicare share systems, and Social Security keeps up with your age and will share with the Centers for Medicare and Medicaid Services, which is CMS, and you see that little logo down to the right, that you are turning 65, and start looking into your information to see if they need to go ahead and issue you a card. So if you do get a card in the mail, you'll be able to determine after today's webinar whether or not you'll want to accept your Medicare card or if you'll want to refuse either Part A and or Part B, depending on your situation, and send that back to Social Security. But I do want to share with you that if you already have Medicare, then your old card needs to get shredded by the end of the year. That old card has your Social Security number on it, and Medicare doesn't want us to use those going forward into 2020. Your new card does not have a Social Security number on it anymore. Now it is a true Medicare number that consists of letters and numbers, but the card still should have the correct name on it, and it should also tell you when you enrolled in your hospital coverage, which is Part A, and when you enrolled in your medical services coverage, which is Part B. So that's important to make sure that that information is correct on your card once you get it. So let's look at the 4 parts of Medicare, and really I want to make sure that you guys make the right decisions at the right time for you. What your coworker decides can be different for you. What your spouse decides can be different for you, and so we want to make sure that you understand that Medicare is individual coverage. There's no option for spouse, the +1 or family coverage, that that Medicare is only a single coverage, and that even spouses can make different decisions for themselves based on where they are in their work history at the time. So let's look at the 4 parts of Medicare. The first one I mentioned is Part A. It covers hospital insurance, and we'll look at a little bit of that in more detail in just a moment. Part B is your medical insurance, and we'll cover what those pieces are. Part C has 3 names. Part C is also known as a Medicare Advantage plan and also known as a health plan in the Medicare system. Part D is the only one that matches, D for drugs, and that is your coverage for your prescription drugs, not over-the-counter, any supplements or that type of thing. So with Medicare, you have a decision to make on how you want your Medicare benefit coverage. You have 2 choices. To the left of the screen, you have the option for Original Medicare, which is Part A, Part B, and you have to have drug coverage whether or not you are taking any prescription medication or not. So you will need to include a standalone drug coverage plan, and Medicare will pay for 80% of your Part A and Part B expenses, so you'll be responsible for the remaining 20% of the cost for hospital or medical Medicare insurance pieces that's going to the doctor, outpatient services. So if you elect Original Medicare, then you'll also need to look into a Medicare supplement policy, also known as Medigap, to pick up that 20%. So you have Original Medicare on the left as an option, and then on the right you have a Medicare Advantage plan option. And I tell people the Medicare Advantage plans are set up very similar to your typical employer coverage, where you'll have an HMO or a PPO, and you'll need to work in the network to get the lowest cost. You do have to be enrolled in Part A and Part B to enroll in a Medicare Advantage plan. You'll want to make sure that that Advantage plan also includes drug coverage unless you are going to be using the VA for your medication. That's really the only exception that we have right now for Advantage plans that don't have drug coverage. The big piece of that is you cannot have a Medigap policy if you select a Medicare Advantage plan. So it's really good to try to figure out prior to you actually needing Medicare on what is going to be the best option for you. So let's look at the cost of Original Medicare. And with Part A's hospital coverage, there is a deductible, and that is a deductible for every 60 days. So there's a benefit period for that hospital deductible of $1,364. If someone, we don't see it often, but if someone is a frequent flyer into the hospital and they go in the hospital in January and then they go into the hospital in June, that's over a 60-day benefit period, and so there's a possibility that they would pay that $1,364 twice in 1 year. If they stay in the hospital on day 61 and above, there's a daily copay, and you can see what those copays would be. Typically, these days we don't stay in the hospital very long, and they almost have heart surgery now at outpatient. But this is good to know in case you are selecting Original Medicare. If by chance you fell and broke your hip or a leg or something and you needed inpatient skilled care, that would be under your Part A. The first 20 days are at zero copay. On day 21, you would be responsible for a copay of $170.50. If you stayed over 100 days, then Medicare stops the coverage and you would be responsible for 100%. So you always want to make sure that you work with the facility to make sure that doesn't happen. You also get home health care under your Part A, and most of the time there's zero copay for those, unless you get medical equipment, and then you would be responsible for 20% of that medical equipment. And if an outpatient prescription drug is given to you, they would most likely bill it under your Part A, or you could elect to say, hey, let me see if it's lower cost with my drug plan. So there are ways to work around drug copays, but $5 isn't too bad these days. With hospice care, that does come under your Part A, and in 2019, and I believe it's going to continue through 2020, if you have an Advantage plan and you do elect for hospice care, then it will roll into your Part A, and your Advantage plan would not cover those hospice care. So you're covered, it's just your Advantage plan doesn't cover it. It would be under your original Medicare option. So let's look at Part A and B, and Social Security will automatically enroll you into Part A and B when you turn 65 if you are already receiving any type of Social Security retirement benefit, or if you are receiving a disability benefit from Social Security, and or you also have Lou Gehrig's disease, ALS, then you would automatically be enrolled. One of the things that I think will affect you guys is if you have a health savings account and you want to continue contributing into that account, then you should not enroll in any part of Medicare when you turn 65. If you did enroll, then that would mean you could no longer make contributions to the health savings account. So you'll really want to work with your HR and your financial planner, your accountant, to make a decision about your health savings account and whether you want to continue to use that or go into Medicare. So if you aren't automatically enrolled because you are getting those benefits we talked about on the previous slide, then when you are turning 65 that year, you have a 7-month initial enrollment period. You have 3 months before the month you turn 65, the month of your birthday, and 3 months after your birthday to enroll. Now, I can tell you, if you enroll the 3 months before your birthday or the month of your birthday, then the month of your birthday, your Medicare will begin. However, if you wait after the month of your birthday, then there will be a slight delay in your Medicare starting. We don't want that to happen because we don't want you to have a day where you're not covered either through employer or Medicare. And so that'll be something that you would be more than, I would encourage you to either talk with the SHIP counselor or your HR to make sure that you don't have any break in coverage if you are going to elect to enroll in Medicare. So let's look at Part B. Before we go to Part A, if you're not going to be using the health savings account, then you may want to go ahead and enroll in Part A because there's typically not a monthly premium for Part A because you earn that by working at least 40 quarters or 10 years and pay your FICA tax. And it would be secondary to your employer coverage if you went into the hospital. So it wouldn't be anything out of your pocket for a premium, and it would be a secondary coverage for hospitalization. However, Part B is a little bit trickier because if you are going to continue working, then you might want to delay your Part B enrollment, and there's no penalty for delaying that enrollment if you have credible drug coverage. And once you no longer have that credible drug coverage, that you enroll in your Part B within 8 months of losing that employer coverage. And the reason why you would want to delay is you don't need to be over-insured, for one. And the second part is if you enroll in Part B, then that initiates your Medicare supplement open enrollment. And we'll get to why that's very important to coordinate that. So continue on with just the Part B. If you don't have active employment and you delay your Part B, then there would be a penalty, and we want you to avoid having to pay more for a benefit. And if you don't enroll, either through your initial enrollment period when you turn 65, or once you lose your active employment, let's say you forget and you remember on that 9th month after you no longer have employer coverage, then you have to wait until the next general enrollment period, which is January 1 through March 31, to enroll in Part B. And the kicker is the coverage does not start until July 1. And we do not want that to happen to any of you guys. So we want to help you make your best Part B enrollment decisions that you can. Just once again, with the Part B and active employer, you will more than likely want to delay enrolling in Part B, and we definitely always want you to double check with your employer how your insurance is going to work with Medicare. I do want to let you know that COBRA coverage is not considered creditable. So when you are looking at retiring and you want to consider maybe extending family coverage, if you are able to do that with an employer, then you would not want that COBRA coverage to be your coverage, and so that can get kind of tricky because Medicare will put you in a penalty phase if you elect to delay your Medicare coverage because you have elected COBRA coverage. So with Part B, the look back on how to set the rate for your premium is based on your income tax 2 years prior. So let's just go over what 2019 looks like. Depending on if you file individually or jointly, and you can see the amounts there, most people pay the $135.50 for their Part B premium. Keep in mind that if both you and your spouse are enrolling in Medicare, then that is $135.50 times 2. And the higher your income is, the higher your Part B premium will be. If there is a significant change in your income when you retire, then you definitely want to contact Social Security to have them review that and change that premium for you, and they do that. So let's look at what Part B covers. And before we look at that, let's look at the Part B deductible. So there's an annual deductible of $185. And then the Part B services, most of the coinsurance is 20%. And I mentioned that this is why you would want to consider getting a Medicare supplement policy or a Medigap policy to help cover this 20% for Part B. And then here's what Part B covers. So it covers when you go to the doctor, when you have outpatient mental health or surgeries or therapy, and it also covers quite a bit of preventative health care services as well. And this is just a great list to look at, and I always want to include this because Medicare around 2015 started including preventative services either at zero copay or a very small copay to encourage folks to get screened for conditions that Medicare has paid out over the years and a high dollar, and so they're trying to prevent someone not getting their diabetes screenings and catching that pre-diabetes numbers and trying to change their diet and increase their exercise or lose weight to avoid being a true diabetic. And so that's just an example of how Medicare does encourage everyone to use the preventative services under their Part B benefit. So I've mentioned several times about the copays and deductibles of Part A and B, and that Medicare will pay 80% of those services, and then you would be responsible for 20% if you elect Original Medicare. So to get that 20% covered, there's an opportunity for you to purchase a Medicare supplement. Most of the time we call it a Medigap policy. It is through private insurance companies, so you would have to contact your insurance agent to purchase that policy, and it will only pay for a Medicare-approved service. So right now, acupuncture is really not covered, and cosmetic surgery, those types of things. But if you go in for cataract surgery, then that would be an approved service, and your Medigap policy would cover that. So the best time to purchase a Medigap policy is when you first enroll in Part B. And your enrollment in Part B initiates the open enrollment for a Medigap policy. And that's the only time that the Medigap policy would not be allowed to put on any medical underwriting, and they wouldn't be allowed to not cover some conditions for pre-existing conditions up to 6 months. So that's why we always encourage people to delay enrolling in Part B while they continue to work with active employment with creditable health care coverage. Because if you go ahead and enroll in Part B, and once you lose your employer coverage, then you would be subject to potentially having medical underwriting or some pre-existing condition clauses in that policy, and we want you to avoid doing that. So let's look at the Medigap plan type. Medicare is not original in how they label things, so not only are the parts of Medicare using the alphabet, but the Medigap plans are also alphabetical. So we're going to be talking about Medigap plans, and you can see we've got A, B, C, D, and on. You'll want to see to the left the Medigap benefits, and the benefits are standardized. So if you are looking at a Medigap plan D as in David or G as in Greg, then the benefits, no matter what company you are looking at, are exactly the same. What you will notice is the premiums will be different, and the market rate of increase could be different. And so we have a comparison tool that we can help you look at how to select a Medigap plan, and that you will be prepared to talk to your insurance agent on selecting that plan. I can tell you that Plan F, as in Frank, will not be available to those folks turning 65 in 2020 and going forward. However, if you are already 65, even if you have not enrolled in Medicare yet, and you plan on retiring in 2022 or so forth, you would be eligible to purchase an F policy. So that will be a little bit different when I'm talking next year about these Medigap policies. So I just want to tell you a little bit about what is not covered by Medicare or a Medigap policy. That's long-term care. If someone goes into a nursing facility for long-term versus just skilled care, then Medicare is not going to cover it. Typically, Medicare doesn't cover vision and dental and hearing aids and private duty nursing services. So the last part of original Medicare is your drug coverage, and this came into play back in 2006. Previously, Medicare had not covered drug coverage. It is available to everyone that's enrolled in any part of Medicare, and it is provided through a standalone prescription drug plan or through an Advantage plan. And these are from insurance companies, and cost can vary plan by plan. And we do use Medicare's plan comparison tool, which is on their official website, which is www.medicare.gov, and that's G-O-V. You always want to make sure you're on their website when you run the plan comparison, and we can do that for you, or you can do that, or we can teach you how to use it. The system is changing this year, so we will be in a learning curve along with everyone else on that. So for this year in 2019, most people will have a monthly premium for a standalone drug plan between $15 and $119. There are Medicare Advantage plans with drug coverage with a 0 monthly premium. So if that's something that you're interested in, we can definitely look at that as well. The yearly deductible for drug coverage for either standalone or an Advantage plan is $415 this year. One thing that is going away as we know it now is the donut hole, and I'm sure you guys have heard about that. And how that works is Medicare included some cost sharing to the Medicare beneficiary because Medicare couldn't absorb the complete cost of prescription drug coverage, or knew they couldn't absorb it. So what they did is they designed a process where there is a full cost of the drug calculator. And every time you go and you fill a prescription, that full cost is being calculated. When you get to a full cost of $38.20, whether or not that's come out of your pocket or not, then that will put you in the donut hole. Once that calculator gets to $76.53.75, then you would come out of the donut hole and only be responsible for 5% of the cost of the drug. While you're in the donut hole, if you are getting a brand name drug, you would be responsible for 25% of that cost. Or if you're getting a generic drug, you would be responsible for 37% of the cost of that drug. So it's kind of crazy how it works, and just if there are folks that you know at church or in your neighborhood that may be struggling with the drug cost, there is help called Extra Help through Social Security or a Medicare savings program through TennCare that we'd be more than happy to see if they would qualify for that. So this is just a quick chart to try to explain the donut hole a little bit better. And so you can just see that as you get to the $3,800, you drop into the donut hole and you pay a little bit more copay, and once that full cost of your drug reaches the $7,600 limit, then you would only be responsible to pay 5% of the drug cost for the remainder of the year. And so the donut hole is an annual thing, and we always work really hard with folks to see if we can delay that happening to them as much as possible. Next year, we will be looking at the donut hole itself is not really going to be a donut hole, and so we're looking at calling it a coverage gap. And so for 2020, You'll pay 100% of your deductible if it is applicable to the plan that you enroll in. And once the full cost of the drug coverage reaches $5,100, then you'll be considered in the coverage gap. And while you're in that coverage gap, then you'll only pay 5%. So it's going to be a little bit different, and I will be updating this slide as soon as the Centers for Medicare and Medicaid Services sends us that slide to use. So just want to let you know it is going to be a little bit different in 2020, and we will have more details about that as soon as open enrollment begins. And speaking of open enrollment, so if you are going to enroll in a prescription drug plan, you can do that during your 7-month initial enrollment period when you're turning 65, or if you are delaying enrollment because you have drug coverage through active employment, then you can delay that and you will get a special enrollment period once you end your employer coverage, and you have 63 days to enroll in a drug plan once you stop working. And keep in mind, with Part B as in boy, you have 8 months. I wish I knew all the details of why they have such differences in when you should enroll for those special enrollment periods, but at least we have it in the slides and you can refer back. But if you continue to work, then you would want to delay your enrollment. So once you retire and you enroll in your drug plan, then every year you will have an annual enrollment period, October the 15th through December the 7th, that you can review your current drug plan and see if it will still be the lowest cost for you, that it will still continue to cover the drugs that you are taking at a reasonable rate, and you can also review their deductible amount. And if it's not going to be the lowest, then you can switch to a different plan during the open enrollment period. So we've talked really quickly about Medicare Part A, B, and D with a Medigap policy. And if you'll remember, that's original Medicare. So we're going to move over to your other option that you have, which is a Medicare Advantage plan. If you elect an Advantage plan, you still are in Medicare and you still get all the same rights and protections of having original Medicare. You get all of the regular Medicare covered services, but with an Advantage plan, to entice you to enroll, they also can cover vision, hearing, and dental. So what we see with Advantage plans is that they do have some vision, hearing, and dental, and then some plans offer a more comprehensive coverage for their dental and their vision. Some plans are now paying portions of hearing aids, and so it's really good to consider looking into an Advantage plan. And you want to make sure that that Advantage plan covers prescription drugs and that they cover your drugs in a reasonable rate. So let's talk about how these Advantage plans work. I mentioned that they're typically like an employer HMO or PPO. So not only do you want to make sure that it covers your drugs, but you also want to make sure that the doctors that you use and the hospital that you want to go to are in network so that you can get the maximum bang for your buck with the Advantage plan. So every year you would want to make sure that your plan covers your drugs, that your doctors will continue to take the plan that you're in, and the hospital that you want to go to takes that plan. I did talk about the Part A deductible, the Part B annual deductible, and with Advantage plans, they are able to make the cost sharing different. And so with the cost sharing, you're going to see that vary from plan to plan. So there could be a monthly health premium And with the 2019 plans in Tennessee, there are Advantage plans that have a monthly premium of $0 up to $221. With Advantage plans, you'll have a health plan premium and or a drug plan premium. Both of those premiums can be $0, and we do have those plans as well. Your deductibles for A, B, and your drug coverage can vary, so that'll be something that you would want to look at. The maximum out-of-pocket expense that you would have with your in-network services with an Advantage plan is $6,700. The maximum out-of-network expense that you would have would be $10,000. So we always recommend that, yes, you can really work and make the Advantage plan an advantage to you versus original Medicare with a supplement, but you'll always want to have at least the $6,700 as a backup just in case that you are really sick one year and you utilize a lot of services that you'll want to have enough money to pay for that out-of-pocket expense that you would have. And once again, there is extra help available through Social Security and also the Medicare Savings Program through TennCare if you know someone that has a limited income or resources and are struggling even to pay Medicare Advantage copays, that we can help them see if they qualify for. So enrolling in an Advantage plan is very similar to your enrollment into original Medicare as far as you can enroll in an Advantage plan in your initial enrollment period. That's when you're turning 65. Or you can delay enrolling because you have employer coverage, and that'll give you the special enrollment period as you see lower on the slide. Then every year, with an Advantage plan, just like your drug plan, you would want to look to see if your Advantage plan will still continue to cover you at the lowest possible premium and cover your drugs, and your doctor will be continuing to accept that plan. So you would have that opportunity during the open enrollment period, which is October the 15th through December the 7th each year. And just a reminder that once you make that decision, then the coverage actually begins January 1. There is an extra Advantage plan open enrollment period. So let's say that you have always had an Advantage plan, and during open enrollment, October the 15th through December 7th, you wanted to stick with the plan you have. Then the first of the year rolls around and you realize you missed a cost, or your doctor isn't going to take that plan, and you think, oh no, I need to change plans. Well, you do have an opportunity to do that with the Medicare Advantage open enrollment period, which is January 1 through March 31. So if you want to change Advantage plans in January, then your enrollment for that different plan would begin February 1st. And so that's how that works. And we'd be more than happy to help you with that change as well. So that is Medicare Fast and Furious in a nutshell. And I'll be more than happy to answer any questions if anyone has them. And so I'll open that up. Does anyone have any questions? All right. Well, if you don't have any questions, I won't keep you on. I do appreciate you all joining the call today. Yeah.
Can you hear me? I do have a couple questions. I'm sorry I got interrupted. I just have a quick question. I just have two quick questions. You were talking about the Advantage plan, and it said $0 up to $221, and you had commented that it could be $0.
Yes.
I was just curious, what do they base that off of? If it's $0 up to $221, how do they determine that premium?
Well, the Advantage plans, when the insurance company, it's my understanding, is when they are looking at the services they want to cover, they also look at the amount that Medicare is going to pay them per member. And so it's my understanding that insurance plans can determine who is going to be in their network, and they can determine what drugs they're going to cover, and based on the member total, then there's a possibility that they wouldn't need a monthly premium. Other plans determine that they, in order to offer the benefits that they're going to offer in that Advantage plan, that they are going to need to charge a premium, and that's why it can get up to $221.
Are these plans Medicare offers?
Or they are private insurance company Medicare Advantage plans. They do have to get approved by Medicare to offer that plan in our state. So you still are in Medicare. You're just getting your Medicare through an Advantage plan.
Okay, so one private insurance, you may have a pool of 10 insurance companies, and one may just happen to provide you a zero premium based on another insurance provider that might provide you a $100 premium. I think that's the way I'm understanding that.
Yeah, and I did have a total. I think there's about 30 plus different Advantage plans available in Tennessee. Yeah, and so I was just kind of opening my Medicare handbook, and just the first one that pops up is Aetna Medicare, and they have 1, 2, 3 different Advantage plans. And however, they're all at zero premium. But Blue Cross Blue Shield has 1, 2, 3, 4, 5, 6, over 10 different Advantage plans, and some are at $0 and some are at $192. So that's why
I was just kind of curious. Yes, it does. I was kind of curious how that worked.
Yeah.
My other question was, you had, I want to make sure I understand this. You had mentioned that once you turn 65, you can sign up for the, accept the card for Medicare. But if you choose not to and you continue to work and you have HSA, let's say a month later you get that person that's working that turned down that card at 65 and they're still working using their HSA, I guess what the main question here is if a month later they get diagnosed with something, that could be considered a pre-existing condition from when they do sign up. Did I understand that correctly?
I think you're getting confused with the Medigap policy.
So that's Medigap. That's not just Medicare.
Right.
Okay.
Yeah, so when you enroll in Original Medicare or an Advantage plan, there is no pre-existing or medical underwriting.
Even if you delay it and use HSA?
Correct.
Okay, that's where I was getting confused. So if a person decides to use their HSA and then they turn down the card and then a month later they get diagnosed with something, that won't be used against them as a pre-existing condition?
No.
Okay.
No. And so let me just clarify. Enrollment into Medicare, there's no medical underwriting or pre-existing. Okay. However, Medicare only pays 80% of Part A and B if you're in Original Medicare. And so when you go to purchase a Medigap policy that will pick up that 20%, then depending on when you enrolled in Part B as in boy, then you possibly could have some pre-existing or medical underwriting for your Medigap policy.
Oh, okay, in Part B to pay the 20%.
Right.
Medigap.
Right.
Okay.
Yeah.
Some underwriting. Okay, that was my questions.
Yeah. And I do want to mention on the health savings account, If you elect not to enroll in Medicare and continue with your health savings account, once you decide that you are going to retire, Social Security has a look back for Medicare eligibility of 6 months. So you really want to work with your HR and your tax person and your financial planner to make sure that that 6-month look back period you weren't eligible for there's a 6-month look back period, and you'll want to make sure that you address that with Social Security before you enroll in Medicare so that you don't have a tax penalty. Eric, I may have just butchered that, but check with your HR folks on that.
Okay, there's a look back due to taxes.
Right. Good question.
Thank you.
You're welcome.
I was in your first one.
Oh, yeah?
And I think I learned more the second one, so.
Well, I tell you, with our counselors, it takes a year to get it all, and we still have to stop and think every now and then, so it's tough. Any other questions? Well, thank you all very much, and I'm going to make sure that this is recorded before I turn that off. And I will try to get this and make it available to you all.
Thank you.
Thank you all very much. I'm going to end the recording now.
Okay, thank you.
Thank you.